Hey, TC, are you there?
Sorry about that. Okay, there I am.
Hey, hi.
Hi, how are you?
Pretty good. How are you doing?
I'm doing pretty well. Remind me, did you want me to? I've got my slides up if we need them, or if you wanted to navigate, that's okay too.
I have yours ready to go, just to be prepared if yours don't work. So we can plan on you doing your thing and clicking as you see fit. And when I saw you in here early, I thought, well, this might be a good way to practice before we officially start. Do you want to try it?
We are in the same mode of thinking. Let me get in here and I'm gonna try sharing my screen. Um, which actually I don't know. So it looks like only people who are assigned the presenter role can share. So we might end up needing to go with your slides. Unless you could make me a presenter, but that sounds complicated.
Yeah, for some reason I thought I did that, but
Let
that's
me,
okay.
if you think you did it, let me come out and pop back in and see if it changes something.
Okay.
Okay. So Sarah, it's looking like that button does not want to go live for me.
Okay. All right. What we will do is I've got yours right here, that I can click on once I get out of my share mode, and I'll just click whenever you need me to click.
That sounds great. It should be pretty intuitive. And then I'm just going to put my contact information in the chat if that's okay.
Okay,
Okay, thank you.
sure.
You'll have to hold the floor down if you don't want me to get chatty because I get chatty.
Okay, that's fine. We try to just do the half hour.
Oh, I meant before everybody logs on.
Oh,
I get all my energy up beforehand.
understood, understood. I think we've got one person in here already because you uh you got in and I clicked okay, and then it it had shifted down when she came in. So uh okay, okay, okay. I have some people in here. Yeah.
All right, that's always a good sign.
Yeah.
Excuse me just a second. I hear something weird in my parking lot. We got that figured out.
All right. Right. TC, can you see my PowerPoint?
I can.
Excellent.
And I just added a link in the chat for the toolkit I'm going to reference.
All right. Very good. All right. Well, it's 11:30, so let's get our meeting started. Thank you, everybody, for being here. Welcome to our February Lunch and Learn. Here is our agenda for the day. I'm new here and new at this. Can everybody hear me okay? TC, you said you could hear me. Okay, good. All right. And if I don't get to admit somebody to a meeting, if anyone out there could just admit people, because sometimes I can't see that screen, that's fantastic if you could do that for me. So we're going to have introductions today, and I'll talk to you a little bit about what I am able to do for school students and staff. We'll talk about my restroom reader updates from our local health department and the state. I have some grant info and resources for you today. We'll talk a little bit about last week's Radon Awareness Month, some conference opportunities and events, and our guest speaker is with us, TC Spellman. She has already put a link in the chat that you can access if you need to know more about what she does. So let's move on. Okay, so yeah, I'm Sarah Jacobs, and you may remember my predecessor, Mary Corman, who also did this. And right there it says you can contact me with questions if you want to schedule any of these programs I'm going to tell you about and reporting illness in your school. I want to make sure that I say that my email address here has changed. The formula has changed slightly. It looks similar, but we now have a .gov added on to our email address. I've got a phone number there for my desk. You can also call me on my county cell, or you can text me on that number too. Make sure I'm letting people in. Okay. And uh, just keep in mind that you can go to our Department of Health website, but what you'll want to do is go to the school outreach page. You can put that in the search bar when you get on the Department of Health website, or you can just Google Allen County Department of Health school outreach or just school, and it should take you to where you want to go. Other things that you'll find there are flyers, one pagers on typical illnesses, things like hand washing. We also have some student made resources on there that you may find helpful to show your students. I have a monthly restroom reader that I put up every through from August to May every month. And these lunch and learns are recorded, so those are also posted. There is our main website, allencountyhealth.com. Before I forget, I know some people don't like to use QR codes, but I made a list of links for everything I'm going to talk about today. And if you would like me to just email that Word document with all the links and a little description of what it is, just put your email in the chat and I will do that for you. All right, let's keep on trucking. All right, so this is the flyer that I have created to show you all the different trainings that I can do for staff and students. I'll send that along if anybody wants me to send that. I can just send the link, Word document links, this flyer, and even some of the resources if you want them. I'm going to be doing classes in personal hygiene, hand washing, dental health, whole health, vaping. Everything's free. And as far as staff goes, I can do Stop the Bleed, CPR, Heart Saver. There's more that I'm working on as well. Some schools want me to do this with students and do a shortened version. I can do that, and it wouldn't be for certification, but I can also do the full certification of any of these classes, also free. This is what that restroom reader looks like. It's one page. It's posted on the website so that schools can print that and put it up on the bathroom stall door. So when students are in there doing their thing, they have something to look at and read. And I usually go with a health topic for the month on things like that, or something that I think maybe students would be interested in and find valuable, complete with QR codes and lighthearted jokes, things like that. I do have to say that right now, the February one is not on the website. They are checking our website for compliance, and I'm not allowed to put any PDFs, but I will email this out to the schools. All right. From our local health department, infectious disease updates. Just regarding that, we appreciate the reporting that you do. I had a school call me yesterday just to say, hey, we're at our 20%. That's coming up down here on my list, but you need to call me to report illnesses. I'm the school liaison. I can talk to Laura Weaver, our supervisor for infectious disease and case management, and just check with her, see what I can do to follow up with you. If an investigation needs to be done, that's when they would move into that sort of mode. If you can't get a hold of me for some reason, I've got a team number on here that will ring these ladies next door to me, and they will handle whatever concerns you have with what's going on in your school. And that last bullet there, the reminder about the 20% rule for schools. Yeah, the school that called me yesterday, they were about 170 students, and they had 35 call in sick with no specific diagnosis, but just they gave me all the symptoms that were going on, and will be in touch with me further if they get more word on what that could possibly be and need to be investigated. So if you need some more information about that 20% rule, uh, just contact me and we'll talk about it and make sure you're on the up and up for what you need to do for that. The Department of Education needs to be contacted for that. So just let me know if you need any help with that or any of the things that I've been talking about today. All right. Well, just because it's the winter months and everybody's trapped inside with all the germs, and it's pretty typical of this time of year, we want to talk about respiratory illness. And the big thing with that, my circle and slash that I've got there on the first bullet is sharing objects is the biggest no-no for that. Whatever that may be, drinks or uh, using the same pens or things like that. We just want to get rid of the sharing objects this time of year. Hand washing should be stressed. This is a tip that I learned just a couple months ago from the IDOH that if you wet your hands before you put the soap in there, it actually helps to prevent your hands getting dry. That is definitely a tip I could have used much earlier in my life. You want to keep cleaning, sanitizing, and disinfecting the surfaces. Just keep clean. And you want to know when to stay home when you feel sick and whether or not it's okay to return to school. So, something that I've included in this slideshow is some images of, and I think a lot of you have seen these. We have magnets that say this. So, if you want to go into the slideshow once I send it to you and you want to print these images and put them up in the school or keep them near your phone or desk, you can do that. We have English, Spanish and Burmese images here of how sick is too sick. This can be sent to parents if needed, put on a website if needed. And if you need more, just let me know. Something that I also got from the National Institute of Health is this common symptoms chart. We've got cold, flu, and COVID-19 symptoms all on here. If this is a good reference for you, you can definitely take this out of the slideshow, and I hope it's helpful. All right. Some things from the Indiana Department of Health. Maybe you know this. They have this statewide standing order for emergency medications. This just got updated recently, I think November or December. Um, and there's also this indoor air quality in schools best practices manual that just got updated in December 2025, I believe. So yeah, they both been updated. You may want to go on there and check that out, see what the updates are. And if you are still interested in getting these emergency medications, I can help you. I have a document that takes you step by step through everything you need, the images you may see, and the things that you need to click on and where you need to look. Just let me know. I can send that document to you as well. And you possibly know about this, but I want you to know that the IDOH has a lot of resources and things. I specifically went to the school administrators and nurses portion of this website. Right here where it says audiences, I mentioned different audiences. There's a drop down where you can pick student, things like that, and just go straight to the site that you want and see what's on there that you may be interested in. Sometimes schools reach out and they want to do hearing screenings or vision screenings, um, a vaccination clinic on site, and the IDOH can provide that. This is their mobile response operations. Just know that you need to get a hold of them and arrange this months in advance. There is a email contact in there too. If you go to this page where you can just ask some questions and not actually fill out the application yet. But if you need anything at the school for a health week or any kind of event like that, this is a way to reach out and get somebody to come for your screenings that you need for the students. All right, so I mentioned some grants and things like that. I want to be as helpful as I can and give you a lot of opportunities for projects you might be thinking about. This is called a tactical urbanism demonstration project supporting active transportation. Um, a very large name for, uh, a doable project. This is it got other names like DIY urbanism, planning by doing, urban acupuncture, urban prototyping. Uh, Anybody can apply for these. There's a lot of groups that are eligible to do this. It could be a school, it could be just a neighborhood group. You have to go in and look at it. It's pretty interesting. The only thing is the deadline for this is coming up on February 26th at 4 p.m. But they did say in there that if you contact them ahead of time, you could get an extension for that deadline. And they want that project to be implemented pretty quick, I think by August or so. But I do have an example on here. Maybe this looks familiar to you. This is just west of downtown Fort Wayne. And I looked at their grant proposal, and it's very simple and low cost. And they had things on there like, we'll need some brooms to sweep off the asphalt. We'll need some tape to tape off the area. We'll need paint, pool noodles. And they made a whole event out of it. And they actually did some traffic calming. You can see, you've probably driven through it, who knows, but they did some traffic calming just to help their community and the children that live there so that vehicles were slowing down and uh, lowering the risk of any kinds of accidents or anybody getting hurt. So that's pretty cool. And if you can think of an idea for your school or something you may need, this could be a great thing to do and get some money for it. All right, we're going to keep on trucking. January was Radon Action Month, and I don't know how much people out there know about it, but this starts out as uranium in the soil, and it does a radioactive decay, eventually getting to the element radon, and it's a clear, odorless gas that can seep into your house or seep into schools. So I thought this was noteworthy to talk about, and it can even come through in water, bedrock, and soil. Uh, I went to the American Lung Association for some information on that, and they have some really cool stuff for schools, from activity books to school challenges. There are webinars on there for school staff. You can get testing kits if you'd like to test the school, which they recommend. It is not required in Indiana, but they do recommend it. And these are the months right now where the windows and the doors are closed. So if radon is present, it is detectable, and they recommend that right now through March, I believe. So I've got a link here. I'll have one in the Word document if you like it that way and have all the links at the same time. But this is something that you could go to and see if your school could benefit from it. All right. So I've been emailed by Brightpoint that they are having this event called a Brunch and Learn. And I told them that I would share this with my Lunch and Learn crowd. It's for nurses, guidance counselors, office staff, etc. Um, you have to RSVP by February 27th, but it's from 10 to 12, and they're obviously having brunch, and they want to talk to you. This is sort of a stepping stone. They want to talk to you about this event that happens later in June, the school conference, the school health conference here. I don't know if anybody's planning on going to that, but Brightpoint would like to talk to you before you do go to that event and give you some more information. So you are free to go in and sign up for that and attend Brightpoint's event before this one later in June. Just something they wanted to reach out with. Okay. Even more opportunities for people who work with students is this local youth worker cafe by the Indiana Youth Institute. This is happening on February 24th, so also coming up. This is happening at AWS, but Anthony Wayne Services, they've renamed themselves Windswell. Uh, This one is about fostering youth self-worth, that's hard, self-worth. And they are going to provide lunch at this event, and you have the opportunity to earn some credits for that as well. So this is the flyer. I'm not sure if the QR code stands out very well on that, but I've got a link for you. And if you'd like to attend that, it's coming up. And later that evening at 6 p.m., same day, I've been told about this free webinar put on by Parents Against Vaping and E-Cigarettes. They call themselves PAVE. So they're having this doctor speak about helping kids navigate nicotine, stress, and mental health. Seems pretty cool. If anybody would like to take part in that, there's the link, and you go in and register. Okay, well, like I said, if you would like me to send these slides to you, if you would like me to send the Word document with all the links just all together, um, please put your email in the chat and I will send anything you'd like. Does anybody have any questions, comments, anything they want to discuss? You can come off mute or you can put a question in the chat. Okay, well, so we will move on to our guest speaker. This is T.C. Spellman from the YWCA, speaking about
Thank you
Teen
so
Dating
much.
Violence Awareness Month. I'm sorry, I stopped to read something in the chat. I'm going to mute myself now, and I'm going to work your, let me stop sharing my screen, and then I'm going to work your PowerPoint in here, TC.
Perfect. Thank you so much. No need to apologize. Thanks everybody for making time. Hopefully you're all having a good lunch. My name is TC. I'm with YWCA Northeast Indiana. And if you've never heard of me before, what we do is we come in and we do preventative education on domestic violence. And we also do education to help empower families to practice more digital safety. So Sarah invited me in because February is Teen Dating Violence Awareness Month. And so if you are, as she's getting those slides up, if you're interested in checking out that more, there is a link. So I have my contact information. And then if you follow that web link, that'll take you to our website that also has a toolkit that my team developed. Here we go. So a little bit about our programs, and I'll keep this brief. YWCA is a local domestic violence advocacy shelter that also supports women in recovery and survivors of sexual violence. If we can go to slide 2. And is that, could we go to slide 2? I'm not seeing anything changing on my end for the slides, but luckily I've got this pretty much memorized. And if there's any questions, please feel free to put those in the chat. So here we go. Yeah, we service Allen, DeKalb, Huntington, Noble, Whitley, and Wells counties. All of our programs are completely free of charge. Most people hear about us through our domestic violence services, including our 24/7 crisis line. But we have many other services as you see listed. If we can go to slide 3, please. And I think I'm figuring out there's a little bit of a time lapse. The education programs that I mentioned, we have at a high school and late middle school level, a healthy and unhealthy relationship session. And then at a middle school level, we have Cyber Sense, where we talk about online safety, cyberbullying, and unfortunately, because of national trends, we have also had to start talking a little bit more in depth about CSAM and how to avoid some of those sexploitation traps that some of our youth are falling into. As I said, February is Teen Dating Violence Awareness Month. So that's going to be on slide 5. we see some statistics that are also available in the toolkit. One of the biggest ones that stood out to me is while 1 in 10 teens in Indiana face teen dating violence, about 81% of parents don't identify that as an issue for their youth. So my goal in the community is really to help bridge that gap so that we can work better together in keeping these kids safe. As you go through that, there is a QR code on slide 6. It's also, again, available on our website, and that has a survey. We're hoping that you would be willing to share with people who are also in the youth field. This is intended for groups about 12 to 24, and it's just a set of questions asking them about how they think about dating, what words they're using, what they say dating looks like. And our goal is actually to publish those results this October as a guide for parents. We also have a book club, which is a first time ever for YWCA. And so the book we're reading this month is Speak, which is a very timely tale. I read it in high school. It's been so interesting going through and reading it again for this activity. That's going to be February 24th from 6 to 8. And that's open to absolutely anyone, registration available. As we're winding down, all I want to leave you with is, as you are looking at your fall schedules and summer's coming up, I really encourage you to reach out if you see that your school does have a need for some of these social emotional learning topics. We're happy to come out for summer classes. We're happy to come out and work with small groups or large classes. Again, my goal is just to share our information so that we can have more people in the community who can recognize those warning signs of dangerous behavior and figure out what the appropriate response is so that we can be a safer collective. And that's me.
All right. Thank you, TC. Were the slides showing up?
I think there was a bit of a delay on it, but we hit it. And again, if anyone has any questions, if you click on that link, everything that I talked about is going to be on the website with that toolkit. Thank you.
Thank you so much for speaking to us today. Does anybody have any questions, comments, concerns? We are going to end ahead of time. That's great. You get some time back. You've got my phone number, my email, text me, anything anybody might want to know. You can always reach out. Otherwise, I think we are able to wrap things up. Thank you, everybody, for being here. Take care.
Sarah, thanks again for having me. I just